How does Pegloticase dissolve severe gout tophi? Imagine a tiny enzyme that can help clear up those stubborn lumps caused by gout. That's what Pegloticase does. It works by transforming uric acid, which often builds up in gout patients, into a more soluble form called allantoin. Uric acid is poorly soluble, so it tends to crystallize in joints and soft tissues, forming those painful tophi. These tophi are deposits of urate crystals that can cause swelling, pain, and joint damage. Humans don't naturally produce the enzyme uricase, which would normally convert uric acid into allantoin. Over time, humans lost this enzyme through evolution. That's why uric acid tends to accumulate in some people, leading to gout. Pegloticase is a lab-made, or recombinant, version of uricase. It's attached to polyethylene glycol, a process called pegylation, which helps it stay in the body longer and reduces immune reactions. When given through in Roman 4, Pegloticase quickly starts working in the bloodstream. Once administered, Pegloticase catalyzes the oxidation of uric acid into allantoin. Allantoin is much more water-soluble, about 5 to 10 times more than uric acid, and is easily excreted by the kidneys. This biochemical reaction causes the uric acid levels in the blood to drop rapidly, often within 24 hours. As uric acid levels decrease, the existing urate crystals in tophi begin to dissolve. This process is gradual, but over months of treatment, the size of tophi can significantly reduce or even disappear. Clinical studies have shown that Pegloticase can effectively reduce tophi in patients with severe gout who haven't responded well to traditional therapies. Because it lowers uric acid levels so effectively, it helps clear out these crystal deposits, relieving pain and preventing joint damage. However, Pegloticase is typically reserved for patients with chronic refractory gout, as it's administered intravenously and can cause infusion reactions or immune responses. That's why it's used under strict medical supervision, often with premedications to reduce side effects. In summary, Pegloticase dissolves severe gout tophi by converting the poorly soluble uric acid into a highly soluble compound called allantoin. This process lowers uric acid levels in the blood and tissues, leading to the gradual breakdown and removal of urate crystal deposits. It addresses the core problem of gout at its root, offering hope for those with stubborn tophi. Always remember, if you're considering this treatment, consult a healthcare professional to determine if it's right for your specific situation, as individual responses can vary.